Hi, this is Dr. Priscilla Silveraj, Professor of Psychology at Hudson Simmons University. So, we are here to learn about anxiety disorders. Anxiety disorders is one of the most common disorders that you'll find among college students, and it's in rapid increase of all ages. Anxiety disorder actually is a mental disorder that arises because of excessive worrying or overwhelming sense of heightened state of emotion that's accompanied by a lot of physiological arousal. So it has both the component of emotional aspect and a physiological aspect to it. So you will see that these are some of the symptoms of an anxiety disorder. There are a lot of emotional symptoms like feeling irritable, having trouble concentrating, anticipating the worst to come for the future, feeling like your mind's going black, or feeling threatened, or being in dread all the time, watching for signs of danger. And then there are some kind of physiological symptoms like you feel nauseous, you have difficulty going to sleep, and shortness of breath, and heart is pounding and sweating. There's so much that goes on physiologically in addition to feeling certain emotions. To actually clearly portray this, here is a link that will be helpful for you. If you can use this link that will be in the description below, if you can use that link to go to this video and watch just an overview of what anxiety disorder looks like from a person going through anxiety for in their life, I think it will give us more clear perspective on this. So there are different types of anxiety disorders. These are just symptoms of overarching what we call the umbrella term, which is the anxiety disorder is the diagnosis that's for the entire group. And the ones that come within anxiety disorders are the first one is called generalized anxiety disorder, or it's also called GAD. Generalized anxiety disorder is when there is a persistent fear, a persistent anxiety without really having a reason or a specific reason why, or a specific threat. It's a lot severe, somewhere close to 6 months or more, when an individual has this heightened state of being anxious for every little thing, and being which is more uncontrollable. Then that's when we say generalized anxiety disorder. Something that, when you watch the video, probably in the previous slide, you would know that that is how life looks like. We do definitely think we get the feeling if you are someone who doesn't have a diagnosis of anxiety, and you are wanting to relate to someone who has anxiety, you would think like, oh, maybe the day when you had to take the SAT, or the final test in your freshman year, you think that, oh, that is what anxiety looks like. Well, that's not. There is so much more that goes on to a person 24/7, in every situation, every circumstance a person has to continually battle thoughts in their mind, and the way they feel physically too. So hopefully, I do have videos that will help you to make the distinction and kind of understand that much more. Here is what's the other anxiety disorder, which is called panic disorder. You will see that we've heard about people who do get this experience of describing it more similar to that of having a heart attack. That's a similar type of experience they feel. They feel like they're really actually going to die. So that definitely has an impact and impairs their everyday functioning. If you click on this, you should be able to watch another video that will explain panic disorder very briefly. And obsessive compulsive disorder, a lot of us do already know what it means, because this is one of the terminologies that we use quite often. But little do we know that what we think obsessive compulsiveness is actually how people who live with OCD actually experience. If you click on this video, and you should be able to see, and in the readings, you should be able to see in the description below a few other links that will help you to know what life is like to someone who has obsessive compulsive disorder. So one of the things I want to point out here is obsessions are the thoughts that people get, and compulsions are the behavior, as more often it's like ritualistic repeating behavior that people do. So that's kind of important for us to understand. And then what we have as a phobia. Phobia, we know there are different types of phobia. Agoraphobia is not wanting to go out because probably the individual is scared that they will have a panic attack, or something is going to happen that's going to be worse because of the irrational fear they carry. There are different types of phobia people have. It is a real fear for them. We can talk about how people develop this, just understanding different reasons why people have this experience of anxiety disorder. Why are they affected by this? We can explain this in terms of the biological aspects, the evolution, the genetic, the biochemical in the brain, or the psychological in terms of how cognitively they have this distorted thinking. Or we could even think in terms of the culture and socio-cultural perspective. So there are different ways we can actually try to understand why a person has this experience of anxiety. So these are a few things that would help us to just get a brief overview of what anxiety disorder is like. So in the next video that follows this, we'll talk about depression and then about suicide, and then we'll bring all that together.